This is the broadcast for May 10, 2019. Antimicrobial resistance. Antimicrobial resistance is the ability of a microbe to resist the effects of antibiotics and other medicines designed to destroy them. All classes of microbes, fungi, viruses, protozoa, and bacteria, can develop resistance. Reasons for the rise of drug-resistant bacteria are linked to an increase in the use of antibiotic and antimicrobial medications. Growing global availability of antibiotics since the 1950s has encouraged genetic selection of mutations which render antimicrobials ineffective. Low control levels on the sales of over-the-counter antimicrobial medications probably resulted in the emergence of resistant bacteria. Antibiotic use in livestock as a method to promote growth leads to antibiotics making their way into the environment and is known to increase levels of resistance. In clinical settings, overuse of antibiotics has become the primary cause of rising levels of antibiotic resistance, as well as missing doses when taking antibiotics. Patients often believe antibiotics are effective for illnesses which cannot be cured with antibiotics, and physicians are willing to prescribe them to ill-informed individuals. For example, 70% to 80% of diarrhea is caused by viral pathogens, for which antibiotics are not effective. However, around 40% of these cases are attempted to be treated with antibiotics. 36% of individuals with a cold or an upper respiratory infection, both viral in origin, were given prescriptions for antibiotics, yet antibiotics are useless against viruses. Antibiotic resistance grows in step with the duration of treatment. Therefore, antibiotic courses should be kept to a minimum. Because of the interconnectedness of the modern world and lack of research and development into new classes of drugs over the past 25 years, antimicrobial resistance is a global challenge. The most recent report by the Interagency Coordination Group on Antimicrobial Resistance concludes that drug-resistant diseases already cause at least 700,000 deaths globally a year, which includes 230,000 deaths from multi-drug-resistant tuberculosis. The Interagency Coordination Group estimates the number will increase to 10 million deaths globally per year by 2050, under the most alarming scenario if no action is taken. In 2015, several organizations and university researchers came together to attempt to quantify the burden of infection caused by antimicrobial resistant bacteria across the European Union and the European Economic Area. The team focused on 5 types of infections involving 8 types of bacteria found in blood or cerebrospinal fluid of infected patients. Data was collected regarding the number of cases, the number of deaths, the locations, severity, and years of life lost due to disability for all the 5 types of infections studied. The models estimated that in 2015, there were 671,689 cases of infection due to antimicrobial resistant bacteria in the 30 countries contained within the European Union and the European Economic Area. These infections likely caused 33,110 deaths and 874,541 disability-adjusted life years. The researchers also found that 63.5% of these antibiotic-resistant infections were associated with healthcare, showing that the majority of these infections occur in hospitals or other places that perform health care. Preventing antimicrobial resistance includes only using antibiotics when absolutely needed, limiting broad-spectrum antibiotics, and strictly using those which target specific organisms. The use of bacteriophages to treat pathogenic bacteria is another proposed path for antimicrobial prevention. In this treatment, bioengineered bacteriophages are used to target multi-drug-resistant bacterial infections. Phage treatment also carries the added benefit of preventing the elimination of beneficial bacteria in the human body. And bacteriophages can be used to destroy bacterial cell walls and membranes through the use of lytic proteins which kill bacteria by making many holes from the inside out. Due to high risk involved in determining the effectiveness of new drugs and the uncertainty in financial returns, enthusiasm of the pharmaceutical industry to pursue new drugs has dampened over the past 2 decades. One of the major pharmaceutical companies developing new antibiotics shut down its research efforts in 2011, citing poor shareholder returns. Yet some small companies are still active in antibiotic research. Measures proposed by the Interagency Coordination Group to address antimicrobial resistance include strengthening infection prevention and control in healthcare facilities and farms using available tools to ensure access to clean water, sanitation, and hygiene in health facilities and the surrounding community. The Interagency Coordination Group also calls on public and private donors to increase investment and innovation into new antimicrobials and tools to better manage waste and provide alternatives to antimicrobials for human, terrestrial, and aquatic animal and plant health, as well as implementation for operational research.